Congratulations, graduates. Woo! You can feel it. You can feel the vibe. And you were all out there for a year or two sort of getting it going, right? Getting the wheels turned. So you got a little amuse-bouche of what it's like to be in public health. I hope your bouche is amused. Think of all the hard work you did to get here today, all the support you had from your family, and thank you, family, and friends, and teachers. I applaud every one of you. It's been pointed out that there have been several commencements for you, especially a privileged group of people. I did my homework and I watched the online commencements that you attended virtually in 2020 and 2021, the years of your actual graduations. The pandemic may have delayed your in-person commencement a year or two, but we all know that good things come to those who wait. And I'm told your third commencement next year is going to be astonishing. So just my theory is what has brought you all together, what you share, is a gift for empathy. And empathy is what I want to talk to you about today. My career sits at an unusual intersection of medicine, journalism, and public health. As a practicing internist and gastroenterologist, I take care of individual patients. As chief medical correspondent for CBS News, I report the news. But in that role, I'm also committed to improving public health by educating viewers about the connections between their own health and the health of the country, sometimes even the health of the planet. But no matter what hat I am wearing, I've come to understand that no credential in any field is as crucial to success as the ability to experience and practice empathy. Empathy is your superpower. It's your superpower. 9 years ago, I came to the NYU Grossman School of Medicine to start something called the Empathy Project. We bring together leaders in medicine, education, entertainment, and technology to promote empathy in healthcare using Hollywood-quality short films. At empathyproject.com, you can see our latest. Not now, later. But go to empathyproject.com. Our latest is a 7-minute animation called The Elephant in the Waiting Room. And it focuses on implicit bias and racism in medicine. You'll get to meet Denise, the empathy elephant, voiced by Whoopi Goldberg, no less. Thank you, Whoopi. Who gently nudges our protagonist, voiced by Ed Helms, thank you, Ed, to follow an empathetic path. People respond to empathy. It turns out patients who experience their caregivers as being empathetic have better outcomes than those who don't. They're more likely to follow advice, for example, to manage their diabetes correctly. Empathy can help us identify and minimize implicit bias. It can improve communication. It can help to establish trust. Right? Where is truth without trust? You can have the truth, you have to have the trust. But empathy also needs to be nurtured. Research shows empathy in medical students tends to start out high, but can wane during clinical training for a number of reasons, including burnout. But what if you're definitely right? They're definitely wrong. You're saying 2 + 2 = 4. And they're certain that 2 + 2 = 5. And that's where, and here's that word again, empathy comes in. Why empathy? Well, let's say scientific truth brushes up against their firmly held belief. I remember how my son Noah felt in exactly that situation. Imagine this. When Noah was about 4, he's now 26, he asked us if there was really a tooth fairy. My wife, Kate, and I fessed up, and he fell to the ground on his stomach, banging his hands on the floor in one of the major tantrums of all time. After a few minutes, the crying died down to the point where he was just intermittently whimpering. You know that state, right? At which point, my then 8-year-old son, Daniel, knelt down, rubbed Noah sweetly on his back, and said, "I know just how you feel, Noah. I felt the same way when I found out there's no Easter bunny." "There's no Easter bunny!" Hands banging on the floor again. Boom. To Noah, that was a full-scale assault on his belief system. So please remember this as you try to change somebody's mind. Sadly, public health advice has become so politicized, so polarizing, that respectful, kind, and productive conversation among people who strongly disagree has become a rarity. There's been a regression to the mean, and I'm not talking about statistics. Being mean has no place in debate, and each and every one of you has an opportunity to help change that. Now, thank you. For sure, there are people you will never reach, but you can still be ambassadors for an empathetic approach. And modeling that approach has value even if you fail to change somebody's mind about a specific issue. Way too often, conversations begin with people coiled, ready to strike. An empathetic approach begins with people uncoiled, ready to listen. You've been studying about public health during, of all things, a pandemic. You've had a front row seat to witness what's gone right and what's gone wrong, not just here, but around the world. And we're going to be trying to recover from it for years to come. Fortunately, you graduates will be right in the middle of that healing process. I hope our leaders, and that's going to include you, have the humility, common sense, and commitment to take a hard look at the last 2 years, learn from them, and invest in a stronger, reimagined public health system. You have had a first-rate education that has helped give you the power to do great things. And as we know from the Spider-Man movies, with great power comes, everybody? Great responsibility. Front goes here. The hardest part of this speech, which it took me 3 months to write, I've never worked so hard on a speech, has been putting this hat on. I'm going to take a wild guess and say, if you're going into public health, you've got more than a little bit of idealism in you. Yes, there will be challenges ahead, and some of you will see things that will break your heart. But you have chosen a career, think of it, in which you can love going to work and get real joy from what you do. How great is that? It's great. I have one last piece of advice. Enjoy this moment. When my mother was about to peel an orange, she would say, "At this moment, this orange has never seen the light of day." Right? This orange, this moment. Today it would be called mindfulness. Back then it was just my mom peeling an orange. So cherish this tremendous moment of accomplishment. Keep nourishing your superpower of empathy and go make the world a better place. I know you can do it. Congratulations, everybody.
Thank you, Dr. LaPook, for your inspiring words.